Are you tired of trying different treatments to help treat lower face jowling and laxity that just don't work? After watching this video, you'll find what treatments actually do work to help snatch and tighten the lower face without surgery, and why some treatments can fall short with treatment of this area. I'm Dr. Stephanie Kappel, a board-certified dermatologist and fellowship-trained procedural and cosmetic dermatologist, and today I'm going to be talking about different treatment options or combination of treatments that can help define and tighten and lift up on the lower face. So first, it's important to understand why we have sagging of the lower face and why we lose definition of the jawline as we gain wisdom and have birthdays. So understanding cranial facial anatomy and the changes that can happen as we gain wisdom and have birthdays will really help enhance your understanding of what treatments may be best for you, while noticing these changes that you're seeing in your own face, or even looking at your parents or your grandparents and noticing what changes are in your future, so that you can stay ahead of the curve, be proactive, and approach it like a clinician when looking at the lower face and what combination of treatments or individual treatments may be best for you. So the explanation of causes. Why do we lose definition on our jawline over time? Well, as we get older, the fat pads under our face can become atrophic or thin with time. In addition, we have bone resorption. If you look at a skull at a 30-year-old, a 40-year-old, a 50-year-old, and a 60-year-old, and different generations and different decades of life, the actual mandible and skull can shift and change, and the bone resorbs over time. The temples get more hollow, the maxillary area of the skull becomes longer and lengthened. That's why we have an increased distance between the nose and the upper lip and the philtrum, which we discussed in other videos. And we also get loss of definition and bone resorption of the mandible or the jawline. Now, the jawline not only looks beautiful for cosmetic reasons, but it also provides a structural support system that helps lift up on the skin and lift up on lower face laxity. So as we lose jaw bone muscle and that mandibular bone, we lose that structural support that was once lifting up that skin, which is now starting to sag and starting to have a little bit of jowling in the lower face area. So by redefining that area, either through different types of injectables, or we'll mention other treatments in this video, but for example, Volux, which is a jawline filler, we can add it to the angle of the jaw or along the jawline, which will not add volume to the face like other hyaluronic acid fillers, but rather provide a structural support to define that jawline. And on the oblique and profile views, give a really beautiful definition so that you don't have that blending of the two cosmetic subunits of like the face and the neck. When you look at people who are older or anatomically don't have a strong jawline, it's almost like those two cosmetic subunits blend into each other, and the face and the neck are kind of just one continuous cosmetic subunit, instead of having a jawline defining the face from the neck, with it like tucking under in this area. So loss of bone formation and thinning out of the fat pads can help, us lose that structure as we get older and gain wisdom and have birthdays. Combining that with a loss of collagen and elastin and the extracellular matrix proteins in our skin, as the epidermis and the dermis of our skin thin over time, contributing more to that kind of folding and jowling and gathering of the skin and the tissue in the lower face, it can just, accentuate the jowling and the lower face laxity as we get older. So understanding, you have bone resorption, you have atrophy or thinning out of the fat pads, you have thinning of the skin. What treatments are going to thicken the skin, like lasers, skincare products, energy-based devices? What products are going to enhance and redefine that jawbone structure and that bone that's been resorbed? That would be like Volux or certain high G prime hyaluronic acid fillers. And what would help tighten the skin would be, things that are going to increase collagen and elastin in the skin, like different lasers, CO2, ablative, non-ablative lasers, also biostimulatory fillers, and so forth. So in this video, we're going to kind of depict the different treatments, but understanding why we lose that definition of that jawline and why that skin doesn't tuck back in like it used to over time is really, really important to understand the mechanism of action in which treatment may help augment or correct these changes that we're seeing. And that may vary with each individual and each individual patient. Also, environmental factors can play a role. What you're eating in your diet, different exposures. Say you have a lot of sun exposure and you have atrophy of the skin, and you lose those extracellular matrix proteins in the skin that give skin that structural support and that thickness and that turgor. Loss of collagen, loss of elastin, which can happen from actinic damage, which dermatologists call sun damage or sun exposure. Environmental toxins toxins and pollutants, your diet, your fluid status, how much fluid you're drinking during the day, people who smoke or have, toxicity or toxins that their, body is exposed to. Sorry if you hear my kiddo coughing in the background. Riley, say hi. This is me balancing my mom life with being a YouTuber. She's doing her VR. Riley, say hi. Also, a loss of fat pads, which can come sometimes from being really lean or really fit. I mean, I'm kind of underweight at the time right now, and I feel like sometimes I start to get a little bit of more sagginess and jowling because I've had a little bit of a weight loss. I've been doing intermittent fasting and I work out 5 times a week, and sometimes I'll notice a little gathering here of my lower face and have to make sure that I stay up to date on my Thermage and my skincare products to increase my collagen stores and just to kind of stay ahead of the curve proactively. So runners can sometimes have what we call facial fat atrophy, and dermatologists can kind of spot a runner the minute we walk through the room in our clinic. And it's not necessarily a bad thing, it's just a craniofacial anatomy change that we see. And I remember in medical school being in a pathophysiology lecture, and someone was explaining to me the metabolic activity of the adipose tissue or the fat in the mid-face in runners is a little bit different, and it has to do with the metabolic rate during that cardio exercise workout routine. When runners are long distance runners, they start to get this almost like hollowness in the face, and it's not proportionate to losing weight or leaning out in other areas of the body. It just specifically happens in this area, and it has to do with free radical formation or metabolic activity in the fat pads in the face. And I'm not really too sure if there's any pathophysiologists out there or physicians who understands the mechanism of action in which the fat atrophy happens, but we see that a lot in runners, and we used to think it was kind of the pulling of the tendons, the SMAs, the ligaments from the constant pounding effect of running that would give them that kind of lower face jowling and laxity, but it has to do with atrophy of the fat and the metabolic rate in that area in the face for some reason. So it's just an example of different lifestyle changes, habits, exposures that can cause significant changes in our face, and knowing what treatments to reverse those changes, like a little bit of Sculptra for a runner, will help kind of add in that volume that has been lost in the mid-face and kind of lift up on any lower face laxity, especially in my younger patients. So it all just depends on what process is going on and how to target it. And sometimes it's multiple different targeted mechanisms of action. For example, you want to stimulate collagen to lift, tighten, and pull the lower face with Thermage. You want to add a little bit more jawline definition with Volux. You want to add a little biostimulatory filler to enhance the body's own regenerative process to add volume where it's been lost in the mid-face, which can help lift up on that lower face. Sometimes we need to do thread lifts that are going to mechanically lift up on the lower face. So we'll get into different procedures and what type of candidate may benefit from that procedure. For example, Ellure is the new revolutionary microcoring tissue tightening or skin tightening device, but I wouldn't recommend an Ellure for a patient who is younger, who is maybe having some laxity because of collagen loss, because just removing tissue or moving skin with microcoring skin excisions is going to probably be better for a patient with thinner skin in like the 5th, 6th, or 7th decade of life, with more gathering of thin skin here, not through stimulation of collagen. So you can tighten the skin by removing skin in a scarless fashion, or you can tighten the skin by stimulating collagen, which usually will have an added benefit of what we call collagen banking, which is a hot topic now on social media because you're inducing your body's own regenerative processes to increase your collagen stores. So as you lose 10% of collagen each decade, you're being proactive and kind of staying ahead of the curve. So not only are you lift, tightening, and pulling the lower face, but you're setting yourself up for a better position as you kind of go through the decades of life where you're going to be losing more collagen. You're starting off with having more collagen stores. So it all just depends on your age, the skin thickness, the changes that are happening, your craniofacial anatomy, different environmental exposures that you have been exposed to, and that's how we recommend different treatments or combination of treatments to help rejuvenate this lower face area without surgery. So what to look for in the lower face? Now, sometimes we'll see a loss of definition and you'll lose that defined jawline over time. Sometimes you'll just see a little bit of more fullness in the jowls or the laxity in the lower skin or the lower face skin at this area. Sometimes you'll see more like laugh lines that are more like accordion lines in the mid-face. And sometimes you'll just see kind of a downturning of the angles of the mouth or the early formation of marionette lines. Now, the formation of marionette lines can happen from atrophy or thinning of the fat pads, thinning of the skin, and more of a loss of the jawline is more from like bone resorption. And some people may have one or both or a combination of these phenomenon happening as we gain wisdom and have birthdays. And it's just important to understand how to address those changes. For people who have marionette lines, you can add a little bit of Sculptra or biostimulatory filler. I know we're kind of shying away from fillers in this day and age, or you can use a tightening device like Thermage, or I'm not the biggest fan of soft wave anal therapy. I feel like the Thermage results are a little bit more substantial and consistent with happier patients. But it depends on if you want to lift from above, if you want to add in that definition and add in that structural support below to address the marionette lines. Now, sometimes you can actually just inject a hyaluronic acid filler into the marionette lines. Usually Volux is my filler of choice. It's the Allergan Vicross technology. But again, a lot of people are shying away from fillers because there was an overabundance of less than qualified and undertrained injectors doing too much filler too fast and making people have these like pillow faces. But when done very conservatively and very methodically, you can do a lot with erasing the marionette lines by just putting a little bit of hyaluronic acid filler in the actual folds in this lower face area. But sometimes adding a little bit above to lift up from above is a more natural approach and can be a little bit more subtle, but actually gives a really beautiful rejuvenating effect. Okay, jawline filler, how does it work? Usually jawline filler can add that structural support where the bone resorption has happened. Remember I talked about the skull that kind of gets resorbed over time and the mandible shrinks and then you don't have that structural support to hold that skin up. Volux is a very high G prime. G prime means it's just a very thick or viscous type of filler. And you won't find Volux around a lot. It actually takes a higher level of skill as an injector to inject Volux, and many injectors aren't comfortable with it. I was there at the launch of Volux and have been a huge proponent of it, but it's a very advanced injection technique and it does a really great job, but you have to really know what you're doing, get it in the right injection plane, use a certain type of needle and technique. And when you add in that jawline definition, especially at the angle of the mouth right here, or the angle of the jawline right here, it just kind of lifts up and it doesn't add a lot of extra volume. So a lot of patients will say, Dr. Kappel, I don't want to look chubby, or I don't want to look like a pillow face. I don't want to have like too much filler in that area. And it doesn't. It just defines and adds volume it doesn't add volume. It adds structural definition to the jawline without adding that extra volume. So you won't look full or like a pillow face. So it's a really great injection and people really do really well with it, especially if you look at your jawline. If it pinches in here a little bit from bone resorption, Volux does a great job of like redefining that as well. Sometimes we'll put a little bit in the chin even, so on profile or AP projection, it just adds a little bit definition, which helps kind of snatch that lower face jowling area of the skin, and it gives a balance and harmony to the lower face on profile view, oblique view, and frontal view as well. So it really depends on each individual's anatomy and their bone structure, but doing a little bit of Volux in the angle along the jawline, anywhere that there is a little divot or a less than consistent defined line, and then a little bit in the chin just to bring everything into a complete picture and in balance. And in balance, not imbalance, gives a really beautiful aesthetic result. Now, next are biostimulatory fillers. Now, how are biostimulatory fillers different than hyaluronic acid jawline fillers? Biostimulatory fillers are like Sculptra, which is polylactic acid, or Radius, which is calcium hydroxyapatite, and there's more biostimulatory fillers that are coming down the pipeline soon. But Sculptra is one of my favorite biostimulatory fillers. You can refer to my other videos where I talk about Sculptra, but Sculptra in the mid-face can do a great job of lifting up, especially on lower face laxity and jawline as well. And it induces your body's own regenerative processes. It induces the fibroblasts, which are the collagen producing cells, to make more collagen, and it helps lift, tighten, and pull. It actually adds volume too. So if there's a little, like even with me, I have like a little kind of deficit in this area. Now some people want to have that. Some people don't mind kind of like filling that in and lifting up on the lower face. And it does a great job of adding a little bit of more structural support and lifting up of the mid face to kind of address lower face laxity. And that is Sculptra or other biostimulatory fillers. Now for Sculptra, usually usually 2 or 3 treatments spaced about 1 month apart is necessary for best results. You have to do a massage. It's called the 5-5-5. You have to massage the area 5 times a day for 5 minutes for 5 days. And the company, it's produced by Galderma, I believe. We used to say you need a vial per decade. I don't believe that. I feel like 2 to 3 treatments is more than enough for most people, whether you're 30 or 40 or 80. You don't need 8 vials if you're 80 and 4 vials if you're 40. I feel like everyone usually gets an improvement after about 2 on average vials, usually spaced about 1 month apart. So next, let's talk about skin tightening devices. So my 2 favorites, and trust me you guys, I've used them all, is Thermage, which is radio frequency. It's an energy-based device. It puts heat in the form of radio frequency into the skin to lift, tighten, and pull and snatch up on that lower face. And I feel that it works better than soft wave or all therapy, which is microfocus ultrasound, which also puts heat in the form of ultrasound into the skin to help stimulate collagen generation and synthesis to help lift, tighten, and pull. But Thermage is usually one-time treatment. There's no risk of hyperpigmentation when it's done correctly with the most updated software, the FLX, and it's done by a skilled provider, not in a med spa where they're buying refurbished machines from 2005. It won't melt the fat. It won't cause fat atrophy. And when it's done correctly, chef's kiss. It's a reproducible result. Everybody loves Thermage. I've had it 4 times in my lifetime. I had it on my 30th birthday, 35, 40, and 45. And now that I'm 47, I'm very glad that I did. So Thermage is a tightening device, and that is different than, for example, Ellacor, which is another tightening device. Tightening device with Ellure uses microcoring technology, where you're basically removing little punch biopsies of skin, little microcores of skin, and you're removing skin in a scarless fashion to basically shrink wrap the skin. Now, Thermage versus Ellure, usually Thermage I use for my patients who are probably under the age of 45 or 50, and for patients who are my more mature beauties with thin crepey skin with a lot of gathering down at the lower face, microcoring and Ellure does a great job. Usually microcoring or Ellure takes about 3 treatments spaced about 1 to 2 months apart. There's downtime of about a week, and after that you can have little red demarcations or squares in the stamp kind of geometric pattern of the device. This is with Ellure, and usually those fade with time, or we have patients come in and we do a little V-beam laser to erase those kind of demarcations or those little squares after the fact. But when the tightening device categories, the 2 ones that I feel work the best, and again, I've used them all, is Thermage for my patients who want to collagen stimulate and collagen bank and to enhance a lift, tightening, and pulling of the skin through collagen synthesis through radio frequency, and then for basically a skin excision where you're basically excising skin and not stimulating collagen so much, but just removing pieces of skin to help snatch up the lower face. That's more Ellure. So usually when I see a patient for consultation, we'll kind of go over their concerns, and I'll look at their skin and evaluate their anatomy and see which one would be better for them. But that's usually how we can kind of determine who would be a better, respondent to Thermage versus Ellure. And sometimes we'll do both, and there's no harm in doing both. They're targeting the same problem through different mechanisms of action, and sometimes when you do different targeted therapies, you get a more well-rounded, balanced, and more enhanced result. So regarding Ellure or microcoring, I've done whole videos on microcoring technology, and we'll show some before and afters hopefully in this video. But you can see it's better for the accordion kind of like fine lines, thin skin that's gathered down here at the lower face. Whereas Thermage is better for kind of like lower face, a little bit of jowling, still younger skin that has some turgor in it that can help enhance collagen stimulation to help induce your body's own regenerative processes to lift, tighten, and pull in that area. The benefit of Thermage is there's no downtime and no risk of hyperpigmentation. Ellure, it's only FDA approved for skin types 1, 2, and 3 because any darker skin tones can be at risk for hyperpigmentation as well. And there is downtime of about 1 week with Ellure, and there could be multiple treatments that are needed to achieve your endpoint goal. So another treatment I want to include is Kybella. Now Kybella is an injectable fat dissolving solution. It's called deoxycholic acid, and sometimes when you have a little extra adipose tissue, to. I remember I'm 47 now, and I did it like, I think at age 40 or 41, when I had a little extra fat pad here, which no matter how much I diet or exercise, it would still never go away. And when I did it, it was only one vial here. It just helps snatch up that lower face, or that like extra little bit of fat in that area, which on the profile kind of just gives this, my brother used to always say like Benjamin Franklin, like it kind of gives like a little downsloping of the profile view, but when you kind of melt that fat, it snatches that back up. So on your profile, you kind of get a tucking up under of that skin, and or that fullness. And so Kybella, when it's injected along the submental area or the double chin area, it just kind of helps give a beautiful aesthetic angle of the jawline, and can help define that jawline area to separate the cosmetic subunits of the face and the neck with a beautiful aesthetic outcome. So that's an option for some people who have a lot of fullness under the jawline or under the chin. And usually, you have to be a candidate for it, because sometimes when you remove the fat, you have to worry about having more laxity in that skin there. But it just depends on, patient selection or candidacy. Oh, you have to see my cute dog, Kobe. Kobe! Say hi, Bubba. You don't need Kybella, you're perfect. That's cute. So last but not least, I want to talk about PDO threads. So PDO threads are almost like a suture material that's actually made up of a similar component of Sculptra, the PLLA, or polylactic acid, which can stimulate collagen synthesis and enhance your body's regenerative processes to make those extracellular matrix proteins that add fullness and increase tightness and skin turgor. So PDO threads act by two mechanisms of action. They mechanically lift up on the lower face. We could do it on the neck too, but since we're talking about jowls and lower face laxity today, it can help lift up on the lower face, but also is like a slow depot filler that's going to stimulate your body's ability to make collagen and add fullness in a beautiful aesthetic outcome. The downside of PDO threads is a little bit more invasive. It takes about maybe 30 minutes in the office to perform the procedure. There's really minimal bruising or swelling, especially with my experience with PDO threads. The only caveat is that they don't last as long as I wish they did. Sometimes companies will say they last 2 or 3 years, but in my experience, to be honest, it usually lasts about 6 months to 12 months, and it all just depends on each individual patient and the types of suture material or threading that is used. But threads can sometimes be another option to lift up on the lower face. It will not preclude you from being a surgical candidate, and I'd like to take this moment to say none of these treatments, Sculptra, Thermage, PDO threads, would ever preclude you from being a surgical candidate later on should you decide to have a facelift or a neck lift in the future. And I can speak on this as a Mohs micrographic surgeon, a dermatologic surgeon who does reconstructive flaps and grafts on the faces of many people who have had these procedures. And I can speak on a non-surgical dermatologist who does a lot of these minimally invasive and non-surgical procedures. There's a lot of fear mongering going on social media, and plastic surgeons are trying to get 30-year-olds in the operating room. They want to operate on you. They want you in the OR. They're not going to want you to spend your money on Thermage and Sculptra and things that are going to, kind of postpone the need for surgery. They want you in the OR, and they want you to have surgery when you're 30, 40, 50, 60, and beyond. So that's not always feasible, nor would I recommend that for many of my patients, but I do want to address this because it's something that I do see a lot on social media from some of my plastic surgeon colleagues out there, and I get asked this a lot for my patients at consultation when I see them in my office. So in conclusion, these are some of my favorite treatments to enhance, tighten, lift, and pull on jawline to help redefine that lower face area. Sometimes, like I said, it's a combination of different treatments, and sometimes it's successive approximations to your goal. If you're a patient of mine in my office, you've seen that before. That's how we operate. We'll basically do one treatment, see how you respond, maybe target it from a different mechanism or a different treatment, and we kind of take a stepwise approach, because if you do too much too fast, you can't tell what is doing what, and also you don't want to overdo it as well. But there's a lot of things, I just can't stop getting Kobe in the frame here. Okay, sorry. But there's a lot of things that we can do to enhance the lower face without surgery, again, that won't preclude you from having surgery later on. So understanding the different anatomical differences, the different ways that you're aging and different changes that you're seeing, and having an astute aesthetic provider who is highly trained and understands how to use these different techniques and how to customize each individual patient treatment just for you, I think is really, really important, and that should be the take-home message. Okay, you guys, I hope this helps. Riley, say bye. It's almost time for bed, and we will see you guys next week. All right, love you. We'll see you next time.